I'm Dr. Sherwood Baxt. This is a little bit of a casual setting for us, but it's a paperwork day in the office, so I thought it'd be an ideal time for me to sit and discuss abdominoplasty, which is probably the most misunderstood operation in all of plastic surgery. The fact that the name tummy tuck has become associated with it makes it sound like it's a quick, easy, simple operation, but it's not. There are many variations of the abdominoplasty which are much less than the full operation. I would say the overwhelming majority of women coming in requesting a full abdominoplasty do not have it done. They end up with something less, either just a liposuction or one of the various variations of the partial abdominoplasty. Let me start at the top with this one and discuss what's involved in the full major operation. Number one, it's a real surgery. It takes about 2 hours to do. We do them all in our own surgery center, and it's done under what's called twilight sleep anesthesia. We don't use general for it. There's a significant recuperation after the operation. It takes weeks, if not a month, until you're really up and functioning again after a full abdominoplasty. And it's the only operation that really hurts in all of plastic surgery because we're sewing the muscles up together. After a pregnancy, the muscles, the rectus muscles, are split apart, and there's a wide gap there, and it's the sewing of the muscles, not just the removing of the skin and the fat. That's the important part. The major drawback to the operation long term is the scar. There is a significant scar. We make it very low, so it's under the underwear line or a small bathing suit line, but there is a scar. And as I said, there are several variations of this operation. Today we do many more of the partial abdominoplasties along with a liposuction perhaps than the full abdominoplasty. Partial abdominoplasties, or you've heard the word mini abdominoplasty, which I don't love, but it's used. We can do as little as just removing a strip of skin on the lower abdomen. We can do the next step along with that, which is removing some skin and tightening the muscles just up to the belly button without relocating the belly button. Another variation, which is called the float operation, where you remove some skin so there's a scar, a shorter scar down, way low down. We lift the skin up, get underneath the belly button, so now we can tighten up even the skin above the belly button and still removing only a relatively small amount of skin. The recuperation for these operations are dramatically shorter than the full abdominoplasty. All of them are still done in our own private surgery center, all again under twilight sleep anesthesia. There's a variation of the operation done for people who have had just significant weight losses. Today we'll see people who have lost 50, 70, 100, I've had 150-pound weight losses, and we'll do only the skin part of the abdominoplasty for that patient. This can be combined with liposuction. We can do certain other areas such as the flank or the love handles, and we use mostly the laser liposuction, or called smart liposuction. At any rate, we are looking forward to seeing you for the consultation. I will go through all of these variations of the surgery for you. We'll see you then.